Good morning everyone, I'm Jason Gould from Chislehurst Chiropractic Clinic, and this morning I'd like to talk to you about core stability. The thing is, core stability, it provides stability for every joint in our body. It's not just for the spine. And there's lots of different things that you can do to improve your core stability. So if you take a shoulder as an example, and we're going to look at core stability for the shoulder, what can you do for it? Well, a lot of the time I'd see a patient who's come in who's injured their shoulder, and sometimes they're going to have pain right here, which could be a biceps tendonitis, and other times it might be here, which could be a supraspinatus muscle, which is one of the rotator cuff tendons. And what commonly happens is the channel that the tendon passes through can sometimes become restricted. Sometimes it's due to a position, and when I say a position, an alignment or a postural issue that might have built up. So for example, if you're using a mouse all the time, or you're on the phone, or carrying a bag, or even sleeping on your shoulder, it can cause the shoulder joint to roll internally, and as it rolls internally, that's how the tendon can get caught and pinched. And it's a little bit like biting your cheek. If you bite your cheek, it swells up, you've then got less space, and what happens? We end up biting it again. Well, the same thing can happen to the tendon. You can pinch the tendon, it swells up, it becomes slightly puffy and restricted and inflamed and tender, and then we catch it again. And that's characterized by a sharp catching or a sharp stabbing pain into the shoulder on movement. You can get other pains as well, but I'm specifically talking about tendonitis. Now, in terms of things that you can do yourself at home, one of the exercises that we often give our patients is to rotate the shoulders back into this position. Now, if you think about it, all day long, we're typing, we're driving, we're using our hands at the front. And the idea is if you can bring your hands back into this position and train the muscles, the supraspinatus muscle that's catching then starts to get less tender and can start to realign the shoulder. This really does make a huge difference. And what we do as chiropractors is we assess the neck and we assess the shoulder to find out if there's any joints that might be causing an imbalance. And when a joint becomes stiff and restricted, that joint controls the muscle, and the muscle then can become sometimes too tight and other times too weak. And when that happens, that's going to create an imbalance in the joint that's going to lead it to rub and create irritation. So with the exercise that I've just suggested you can do, sit up straight, have good posture when you're doing the exercise, and rotate the arms. You should not have any pain when you're doing this exercise, but in this position, have your arms rotating out and hold that position for 5 to 10 seconds. And then relax. You can roll your shoulders a couple of times if you want to, and then do the exercise again. If you repeat that 10 times, that will really make a big difference to starting to retrain that shoulder position. Thank you very much. That's Jason Gould from Chislehurst Chiropractic Clinic, and getting you back to health.